Which of the following is a task that nursing assistants commonly do? A. Giving medication. B. Bathing residents. C. Changing sterile dressings. D. Giving tube feedings. Answer: B. Bathing residents. Dementia is A. Terminal illness. B. Loss of mental abilities. C. The number of days a person stays in a healthcare facility. D. Caring for the whole person. Answer: B. Loss of mental abilities. Which of the following is an example of nonverbal communication? A. Writing a note in a residence chart. B. Giving an oral report to a supervisor. C. Smiling at a new resident. D. Speaking in an encouraging tone of voice to a resident who is moving slowly. Answer: C. Smiling at a new resident. Which of the following types of healthcare is generally for people who will die in 6 months or less? A. Long-term care. B. Outpatient care. C. Intergenerational care. D. Hospice care. Answer: D. Hospice care. How many hours of training does OBRA require for nursing assistants? A. At least 150 hours. B. At least 100 hours. C. At least 75 hours. D. At least 50 hours. Answer: C. At least 75 hours. Which of the following statements is true of a nursing assistant's role in restorative care? A. If a resident takes too long to do a task by himself, the nursing assistant should do it for him. B. The nursing assistant should give the resident pain medication just before the rehabilitation session begins. C. The nursing assistant should recognize that setbacks occur and be reassuring. D. The nursing assistant should tell the family progress is happening faster than it really is so they can feel better about the situation. Answer: C. The nursing assistant should recognize that setbacks occur and be reassuring. One reason that the Health Insurance Portability and Accountability Act, HIPAA, was created is to A. Make sure nursing assistants receive adequate pay. B. Protect privacy of health information. C. Ensure that care procedures are performed properly. D. Prevent abuse of residents. Answer: B. Protect privacy of health information. Which of the following is an example of professional and ethical behavior by a nursing assistant? A. Keeping quiet if he makes a mistake. B. Documenting care accurately and promptly. C. Telling his friend details about the residents he works with. D. Rushing a resident through tasks if there is not much time left in the nursing assistant's shift. Answer: B. Documenting care accurately and promptly. To maintain good body mechanics while lifting or carrying an object, a nursing assistant should A. Hold the object out and away from her body. B. Face the object or person she is moving. C. Twist at the waist as she picks up the object. D. Try to keep her center of gravity as high as possible. Answer: B. Face the object or person she is moving. When is it appropriate to use medical terminology? A. When communicating with the care team. B. When communicating with residents. C. When communicating with residents' families. D. When communicating with visitors. Answer: A. When communicating with the care team. What information does a Material Safety Data Sheet, MSDS, contain? A. Costs of the chemical. B. Comparisons with other chemicals. C. Names of other facilities using the chemical. D. Description of emergency response actions. Answer: D. Description of emergency response actions. Which of the following statements contains objective information? A. Mr. Castillo seems a little grouchy today. B. Mr. Castillo says that he has a stomachache. C. Mr. Castillo's blood pressure is 115/68. D. Mr. Castillo doesn't get along with the nurses very well. Answer: C. Mr. Castillo's blood pressure is 115/68. A resident's health information may be shared with A. Anyone who asks. B. Anyone who lives or works at the facility. C. The resident's friends and family. D. Other care team members. Answer: D. Other care team members. If a resident is hearing impaired, a nursing assistant should A. Approach the resident from behind. B. Make sure the light is on the nursing assistant's face. C. Raise the pitch of her voice. D. Chew gum while speaking to the resident. Answer: B. Make sure the light is on the nursing assistant's face. Holistic care focuses on A. The whole person, including physical, mental, and social well-being. B. Disease and disability. C. How sick a person is. D. The absence of disease and illness. Answer: A. The whole person, including physical, mental, and social well-being. The federal government requires hours of continuing education for nursing assistants each year. A. 10. B. 12. C. 15. D. 18. Answer: B. 12. Which of the following is a physical need? A. The need to be accepted. B. The need for self-esteem. C. The need to be free from pain. D. The need for independence. Answer: C. The need to be free from pain. If a nursing assistant encounters a resident in a sexual situation, she should A. Call the resident's clergyperson to discuss it. B. Provide privacy and leave the room. C. Tell other residents and staff members about it. D. Ask the resident to stop what she is doing. Answer: B. Provide privacy and leave the room. Which of the following is true of most elderly people? A. They are active and have many interests. B. They do not manage money well. C. They are usually grouchy. D. They do not like to leave home. Answer: A. They are active and have many interests. Making an area or object completely free of all microorganisms is called A. Infection prevention. B. Disinfection. C. Transmission. D. Surgical asepsis. Answer: D. Surgical asepsis. One way for a nursing assistant to communicate effectively with a visually impaired resident is to A. Wait until the resident speaks to her before identifying herself. B. Move the furniture in the resident's room to make it easier for him to get around. C. Avoid talking to the resident during care. D. Use the face of an imaginary clock to explain the position of objects. Answer: D. Use the face of an imaginary clock to explain the position of objects. Restraints may be used. A. Whenever it is convenient for the facility staff. B. When a resident is being uncooperative. C. When there are not enough staff members to watch all the residents. D. Only with a doctor's order. Answer: D. Only with a doctor's order. Infection prevention is A. The way in which infections occur. B. An infection limited to a specific part of the body. C. A set of methods used to prevent the spread of disease. D. An object that has not been contaminated with pathogens. Answer: C. A set of methods used to prevent the spread of disease. In military time, 7:45 p.m. would be A. 0745 hours. B. 1975 hours. C. 1945 hours. D. 0775 hours. Answer: C. 1945 hours. How is HIV spread? A. Through the air. B. By hugging an infected person. C. By standing next to an infected person. D. By blood. Answer: D. By blood. In which of the following procedures must a nursing assistant always wear gloves? A. Shaving a resident. B. Combing or brushing hair. C. Dressing a resident. D. Turning a resident. Answer: A. Shaving a resident. Most of the accidents in a facility are related to A. Falls, B. Burns, C. Poisoning, D. Choking. Answer A. Falls. When beginning to weigh a resident, the scale should be balanced at A. -2 pounds, B. 5 pounds, C. 10 pounds, D. 0. Answer D. 0. One way to prevent burns and scalds is to A. Leave warm water applications on for more than 30 minutes at a time. B. Serve residents drinks while they are standing. C. Check water temperature before giving a bath or shower. D. Use higher settings on hair dryers so residents' hair is not wet for too long. Answer C. Check water temperature before giving a bath or shower. If a nursing assistant is in an emergency situation but has not been trained to perform CPR, she should A. Perform CPR anyway. B. Ask someone at the scene to tell her how to do it. C. Give basic first aid until the emergency medical team arrives. D. Do nothing. Answer C. Give basic first aid until the emergency medical team arrives. A good way to help new residents adjust to life in the facility is A. Think about how it would feel to have to move into a facility. B. Tell the resident how much work it is to care for him. C. Cover up any mistakes to make the resident feel more confident about the facility's care. D. Push residents to join in activities even if they say they don't want to. Answer A. Think about how it would feel to have to move into a facility. Which of the following is true of transmission-based precautions? A. You do not need to practice standard precautions if you practice transmission-based precautions. B. They are exactly the same as standard precautions. C. They are practiced in addition to standard precautions. D. They will not be listed in the care plan so as not to alarm anyone. Answer C. They are practiced in addition to standard precautions. Which of the following behaviors promotes residents' rights? A. Deciding which clothing a resident should wear if she takes too long to decide for herself. B. Letting residents know when they are eating too slowly. C. Providing privacy during all care procedures. D. Restricting visitors for uncooperative residents. Answer C. Providing privacy during all care procedures. Dangling means A. Sitting up with feet over side of bed. B. Sitting up in chair with feet on floor. C. Lying in bed with feet over side of bed. D. Hanging both arms over chair rests. Answer A. Sitting up with feet over side of bed. Which of the following is true of bladder retraining? A. The NA should encourage the resident to drink plenty of fluids even if incontinence is a problem. B. The NA does not need to keep a record of the resident's bladder habits. C. The NA does not need to wear gloves when handling body wastes. D. The NA should let the resident know when he or she is taking too long to urinate. Answer A. The NA should encourage the resident to drink plenty of fluids even if incontinence is a problem. In which position is a resident if he is lying flat on his back with his head and shoulders supported by a pillow? A. Lateral position. B. Sims position. C. Supine position. D. Prone position. Answer C. Supine position. When handling dirty linen, a nursing assistant should A. Carry it close to her uniform. B. Wear gloves. C. Fold or roll it so the dirty area is on the outside. D. Shake it to remove any particles before disposing of it. Answer B. Wear gloves. When transferring a resident who has a weak side. A. The weak side moves first. B. The strong side moves first. C. The strong side and weak side move at the same time. D. It does not matter which side moves first. Answer B. The strong side moves first. A general rule for bathing a person is A. Wash from dirtiest to cleanest. B. Wash from cleanest to dirtiest. C. Wash body parts in whatever order the resident prefers. D. Wash body parts in whatever order the nursing assistant prefers. Answer B. Wash from cleanest to dirtiest. When assisting a resident who has one weak side with dressing, A. Clothing should be put on the weak side first. B. Clothing should be put on the strong side first. C. The weak side should be referred to as the bad side. D. It does not matter which side clothing is put on first. Answer A. Clothing should be put on the weak side first. Which of the following terms describes a bed that is completely made with the bedspread and blankets in place? A. Closed bed. B. Open bed. C. Occupied bed. D. Unoccupied bed. Answer A. Closed bed. Under standard precautions, the term body fluids includes A. Sweat. B. Water. C. Juice. D. Urine. Answer D. Urine. A nursing assistant should give nail care. A. Whenever she has time. B. When she notices a resident's nails are getting long. C. When she is bathing a resident. D. When the resident's nail polish wears off. Answer C. When she is bathing a resident. Which method of taking temperature is considered to be the most accurate? A. Oral. B. Rectal. C. Tympanic. D. Axillary. Answer B. Rectal. The normal pulse rate for adults is A. 25 to 50 bpm. B. 60 to 100 bpm. C. 100 to 150 bpm. D. 150 to 175 bpm. Answer B. 60 to 100 bpm. If a nursing assistant sees a resident being sexually abused, she should A. Remove the resident from the situation immediately and report it to the nurse. B. Pretend not to see it to avoid embarrassing the resident. C. Tell the resident's family. D. Confront the abuser herself. Answer A. Remove the resident from the situation immediately and report it to the nurse. Difficulty breathing is called A. Eupnea. B. Apnea. C. Tachypnea. D. Dyspnea. Answer D. Dyspnea. Draw sheets are used A. To keep the bed covers from pushing down on residents' feet. B. To keep the fingers from curling tightly. C. To keep a resident's joints in the correct position. D. To prevent skin damage caused by shearing. Answer D. To prevent skin damage caused by shearing. The normal respiration rate for adults is A. 18 to 30 breaths per minute. B. 15 to 25 breaths per minute. C. 12 to 20 breaths per minute. D. 8 to 10 breaths per minute. Answer C. 12 to 20 breaths per minute. The most essential nutrient for life is A. Protein. B. Fat. C. Carbohydrates. D. Water. Answer D. Water.